My name is Veronica Wertz, and today I'll be presenting my Keystone Critical Condition, Assessing Barriers and Systemic Gaps in Neonatal and Maternal Sepsis Prevention in Zambia. That sounds like a mouthful, but I promise I'll walk you through it. And a special thank you to my advisor, Dr. David Hamer, who's here today, for all his help. So I want to start by saying that this is a part of a much larger collaborative country health profile that's being conducted as a collaborative effort between all of these different organizations, led by Dr. Godfrey Biemba of the Ministry of Health in Zambia, who also works with BUSPH. So that's kind of how I got involved in this with Dr. Hamer, and I will be specifically focusing on neonatal and maternal sepsis. So just to ground us in maternal health, according to the United Nations, every 7 seconds, a pregnant woman or a newborn baby dies, or a baby is stillborn from preventable causes. It's a really drastic statistic, and when we think about that, even in the context of these presentations, that's a lot of lives lost. One of the biggest difficulties in maternal health is a data deficiency, so projects like this are crucially important to tackle those deficiencies, providing real statistics on the state of the conditions and also the state of the healthcare systems. So what is sepsis? Well, sepsis is the body's extreme inflammatory response to an infection. Not to scare you, but pretty much anything can go septic. So bacterial infections, viral infections, fungal infections, they can all turn septic, which is basically when that infection spreads to your bloodstream, then gets into your organs, organ systems, ultimately leading to organ system death, and then death. It has a 30 to 40% mortality rate globally, according to the WHO, so it's very, very critical. And it's prevalent in high-risk groups. So that's things like people with other comorbidities, very old people, very young people, pregnant women, and babies. Which brings us to maternal sepsis, which occurs during pregnancy, childbirth, or the postpartum period, and neonatal sepsis, which is defined as newborns under 28 days old. Sepsis is a leading cause of death of mothers and babies across the world, and specifically in Zambia, which is where this country health profile will be focusing. Zambia is a country in sub-Saharan Africa. I highlighted it on the map over there for you. And it is home to a lot of our researchers. It's home to a lot of geographic diversity, diversity of people. It's a very exciting country, and the researchers there have been doing great work in maternal health, which I will detail. So my project overview is 3 parts. The first part is a literature review, which I will spare you for today because we do not have the time, but if you're interested, you can read it. And then it's a presentation of current epidemiological trends. So like I said, that data showing exactly what the state of the situation is really important, and this is aiming to do that. And then it's a health system analysis. So it's looking at the system in Zambia and showing what we're qualified to care, the care that's going really well, and different indicators that show gaps in care that can be prevented. So those epidemiological trends. First, this is the neonatal mortality rate over time. We can see that over the past 20 or so years, the neonatal mortality rate has been dropping pretty significantly in Zambia. That's good news, but it's not perfect. We still have a pretty high neonatal mortality rate per 1,000 live births. So that's what this project is aiming to tackle to help make that line even sharper. This graph's a little bit more complicated, but these are the sepsis rates. So if you look at that red line, that's your pre-discharge sepsis rate. So before you leave the hospital, those are all the cases of sepsis, and that's presented per 1,000 births. And what we can see is that's actually been increasing pretty significantly over the past couple of years. So that's something that this project also will be highlighting, is different gaps in care that are contributing to that increase. On that blue axis, we can see the delivery complication sepsis rates. So this is the percentage of live births that result directly in a case of sepsis, and that has been decreasing. So that's good news, is we have pretty clean births, but that sepsis rate is still increasing before discharge, indicates that these are likely facility-borne infections that are happening after the baby is born, but still within the hospital. And it's not occurring primarily as a result of that delivery, like I said. So to better understand these statistics, we need to look at the healthcare system, which leads me to our health system analysis. To understand the health system analysis, we need to first understand that Zambia has a 3-tier system. So they have mini hospitals, there's 100 of those. Those are the lowest capability facilities, but they are also the most far-reaching. So these are in rural areas. They have the least skilled birth personnel, the least equipment, but they are the most numerous. Then we have primary facilities. There are 73 of those across the country. Those are a little bit higher acuity. They have a little bit more supplies, a little bit more infrastructure. And then those secondary facilities, that's where you're going to see really surgical suites. You're going to see more skilled birth personnel. You're going to see a little bit higher acuity care, but there are much fewer of those. So this is really the bulk of the project. It's a service availability readiness assessment, or the SARA analysis. And essentially what it does is it looks at a number of different interventions. So this was across all maternal and neonatal care, and I've specifically picked out the ones related to infection prevention and related to sepsis. And it's disaggregated by facility level, so you can see that the second level, the first level, and the mini hospitals. And this is the percentage of hospitals that have that coverage. So when we walk through it, we can see things that are going really well. Things like antibiotic treatments for different STIs, screening for different STIs, syphilis detection, antibiotics for preterm rupture of membranes. These are all showing great prevalence of coverage. We can see upwards of 95% coverage. We also see things that are going quite poorly. We see only about 20% prevalence, 13% prevalence for chlorhexidine of cord care, and community-based antibiotic delivery. So these are clear indicators of gaps in care that can be addressed. Additionally, we have things that are really varied based on the facility level. So we see at the lowest facility level, 10% coverage. Meanwhile, when we get up to that highest level, it's at 65%. So again, these are really clear indicators of where the gaps in care are occurring and how we can address specifically mini hospitals for that specific indicator. We also did the same thing for the feasibility assessment. So this is a little bit more related to the infrastructure of the hospitals. And we can walk through this again. We see a lot of these are actually going very well. Sterilization equipment, delivery packs, suction. I'm not going to read them all, you can read them. But they are going very well, upwards of 95% coverage. Meanwhile, again, that chlorhexidine availability and the use of chlorhexidine, although this is kind of debated, the efficacy of chlorhexidine, we still see very low prevalence. And then we see ones that are sort of in the middle here. And I think I want to point out that the statistics in this might look like a lot, 58% is higher than 10, but it's still only 1 in every 2 facilities. So that's still a clear gap in care that we can be highlighting. So, like I said, this is showing you gaps in care, and you might be wondering why that's important. Well, kind of when you're throwing darts, it's really good to have a target. So if you know what's going well, and you know what's not going well, you know where to spend your money and your resources. So I've highlighted the services that have the lowest amount of availability, as well as the lowest feasibility in the feasibility assessment, in order to indicate those gaps in care. So why does this matter? Well, the data helps give us a comprehensive picture of the situation. It shows us the actual rates of sepsis, the actual rates of mortality that maybe we didn't know before. That's the real importance of this project, is addressing that data deficiency. Additionally, it's highlighting those areas of success and places for improvement. This is going to help us to streamline research and funding efforts to show where money would be best used and how resources can be best allocated. It indicates physical supply needs and informs the training protocols. So it's telling what hospitals where need what and how they can be better training staff to be decreasing maternal and neonatal mortality. Overall, this will hopefully improve infection prevention and decrease mortality. Thank you so much. I wanted to say a special thank you to my advisor, as well as all the team in Zambia, and a couple of other people up on the screen. If you have any questions.
So I know this study focused on Zambia. Are there similar studies happening in neighboring countries?
Yeah, I mean, I'm sure there are. Yes. All right, I think we're all good.